Now we will go to a press conference being held by New York Governor Andrew Cuomo with another update on the coronavirus. Let's listen in.
The better. And that's why we're doing this on a daily basis. We're also increasing our testing capacity because, again, the more you can test, the better. I want to thank Northwell and Michael Dowling and Dr. Krashansky and Stony Brook, who will be doing testing in concert with the state and will be helping us not just on Long Island, but in the metropolitan area, where we're working with a number of other laboratories to increase our testing capacity. The state can test at what's called Wadsworth Laboratory, but Dr. Zucker, our health commissioner, has been working with the federal government. We now have approval to work with other labs also, so we'll be increasing that testing capacity. One of the points I'd like to stress today, you know, people, there's a level of anxiety and fear that is out there because of this virus and the constant press attention. Why do people get afraid? There's always one of two reasons. You get afraid either because you think you are not getting the right information, or you're confused by the information, or because the information itself is frightening. The information itself, the facts here, are not frightening. I think what's causing anxiety is that people are confused and they're getting conflicting messages. And if you listen to the radio or you watch these cable stations all day long, you see all these people spouting different theories and different opinions. The way I handle it with doctors in general, I say to a doctor, and I love doctors. I love all doctors. My sister's a doctor. But I say to doctors, before you give me your opinion, give me the facts, okay? And then give me your opinion. There are facts, and then there's an opinion that you draw from the facts, right? So in this situation, what are the facts? Because there has been confusion. A suggestion that maybe this virus is seasonal and then it's going to go away in the summer. That is not a fact, it's an opinion. Some people believe it will go away in the summer. Some people believe it won't. But we don't have a definitive answer as to when the virus naturally will abate. Well, when will we have a vaccine? The president said we're going to have it shortly. CDC says it's about a year. The president met with medical research companies, pushed them to work as hard as they could to come up with a vaccine. The companies say they may develop a vaccine in a matter of weeks or a couple of months. But whatever they develop then has to be tested. And by the time it's tested is 12 months to 18 months, depending on how the tests actually go. How does it spread? It spreads like the flu spreads. But this is a respiratory illness. So it spreads from a cough, it spreads from a sneeze. Theoretically, a 6-foot radius is the proximate radius that droplets of a sneeze or a cough could travel. Or somebody sneezes on their hand and then they put their hand on the surface and then you touch the surface. The virus on a hard surface lives for about 24 hours. That's why we talk about disinfecting mass transit systems, et cetera, and why that's important. Should we shake hands and should we hug? We just bumped elbows in this meeting, which is a different kind of feeling, frankly, and a different look. Every flu season, Dr. Zucker recommends to me that I tell people they shouldn't shake hands and they shouldn't hug. I have never followed his advice personally nor professionally, and I have never said to the public, oh, it's flu season, you should not shake hands and you should not hug. I have two issues with that. Number one, I'm in elected office. I shake hands for a living. That's what I do. Number two, I'm from Italian-American heritage. I'm a hugger. I'm a big hugger. So if, as a matter of precaution, don't shake hands, don't hug. It's good advice in a normal flu season. It's good advice now during the coronavirus situation. Well, the number of people tested and found positive keeps going up. Yes, it will, and it will continue to go up. I've said that from day one. When this is over, we will have dozens and dozens and dozens of cases, okay? Now, the question that really matters is, so what? So what? What's the bottom line to all of this? The bottom line to all of this is 80% of the people who have the coronavirus will resolve themselves. 80% will get the virus, they'll feel some symptoms, and then they will self-resolve. About 20% will be seriously ill, possibly requiring hospitalization. And for some very small percentage, it could be lethal. The people who have to be most concerned, senior citizens, people who have an underlying immune-compromised situation, or an underlying illness. Those are the people who we have to work hardest to protect. What am I worried about as governor? Nursing homes, senior congregate facilities. That is where we have to do our best work, because that is a population that could be subject to a serious situation if the coronavirus was present there. What do I worry about personally? Because we all have family members, and in family members you always have one member who's a little more nervous than the others. My family, I have a brother who is an extraordinarily anxious personality, always has been, always will be. He's just anxious by nature. So he has a lot of questions. I have a mother who is elderly. She doesn't think of herself as elderly, and don't tell her I said she was elderly. I will deny it. But we have to be careful for my mother. I said, you want to think about using hand sanitizer. You want to think about where you're going and what you're doing, which would also be true during a flu season, right? It's just extrapolating from a flu season. That's what this is all about. So let's keep the perspective. Let's understand what this is. We have data. We have experience. We're not dealing with an unknown situation. This has gone through China. There's been thousands of people who have experienced this disease. So we know what we're dealing with. And also remember, where this is going to be most problematic globally will be for those countries that don't have a sophisticated healthcare system. Luckily, in this country, and certainly in this state, we have the most sophisticated healthcare system probably on the globe. So we're coordinated, we're on top of it, we're diligent, but we also have to keep it all in focus. With that, let me turn it over to County Executive Laura Curran, and then you'll hear from County Executive Steve Bellone. Thank you.
Governor, thank you very much, and thanks for being with us again on Long Island. We really appreciate it. And I also want to thank you for the reassuring tone. Our job today and always is to reassure the public by giving the facts. I really want to thank my Commissioner of Health, Dr. Larry Eisenstein, and his team, who has been working 24/7, around the clock, weekends, holidays, since this has emerged, monitoring the situation and just doing the hard work. So as you've heard from the governor, we do have our first positive case in Nassau County. It's a man in his early 40s who tested positive at Wadsworth. He is in hospital isolation now. When we got the positive result this morning, we immediately took the next step, and that is the Department of Health launched a contact investigation. So what does that mean? A contact investigation is where the patient is interviewed And there is an analysis done. We have contact investigators who go out, a team who go out and look at the man's routine, at possible contacts. And if anyone is deemed at risk, the Department of Health will contact this person. This patient's close contacts have already been advised to isolate themselves. This team of contact investigators is very experienced. They do this every day with various diseases. Of course, with this situation that we're experiencing now with the coronavirus, they are scaling up. I also want to let our residents know that we have a volunteer corps of 1,000 volunteers, medical professionals, doctors, nurses, et cetera, who drill for this sort of thing year-round. And I also don't have to tell you we have the best hospitals here on Long Island and the best hospital networks, and we're very lucky to have that. We are setting up a county call center, so we'll get you the number to the press as soon as we have the number set up. In the meantime, there's a state hotline, which is, everyone knows it, but I'll repeat it again, 888-364-3065. That has been up and running. I'm very happy to hear the news about local testing. It is imperative that we have local testing so we can do more tests and get quicker results, and I think that is also a good way to reassure the public. The goal now is to avoid community spread. That's why we do the contact investigation. And I just want to affirm and repeat that there is no need to panic. If you live on Long Island, you can go about your daily routine, your normal behavior. But please, take care of yourself. Wash your hands. Do the elbow bump. That's what we do when we met each other. Usually when I meet the governor, we have a little kiss on the cheek, a little handshake, but now we're doing this everywhere we go. So keep doing that. I am also heartened by the emergency powers that the governor has now, that we can get the help and the resources that we need to the county. So thank you again.
Thank you, County Executive. County Executive Stephen Bellone.
Thank you, Governor. It's good to be here. Usually when we're gathered at the Long Island Welcome Center, there's a massive blizzard outside that's occurring. I'm not sure this is better. But I want to thank the governor for his leadership on this issue once again. And of course, as County Executive Curran said, his calming tone and reassurances to the public, because I think that is the most important thing we need to do here. I can tell you that we have been in close coordination with the state health department. I want to thank Dr. Zucker and his team from the very beginning here. Our health commissioner, Dr. Piggott, and his team are doing an outstanding job. We are currently monitoring a number of individuals, about 15. There are 3 under investigation for being tested, essentially. Right now, we do not have a confirmed case in Suffolk County at this point. But obviously, we understand, as the governor mentioned, the testing is happening. That is likely to happen at some point. What we want the public to know is, obviously, we are ready. We have been working on this from the very beginning. There are a number of things we're doing. Yesterday, for example, we briefed all of the superintendents. Our health department and our emergency management team briefed all of our school districts yesterday. Today, we conducted a tabletop exercise for all of our emergency management team, health team, in coordination with the state. Tomorrow, we'll be briefing the East End fire chiefs and departments, conducting a briefing for the county legislature as well. So these are the things types of things that we have been doing, we'll continue to do. I want to thank all of our health leaders here that are convened for the great work that they do each and every day. But we're seeing the excellence that we have in this region in terms of our healthcare system really shine in a crisis like this. So I want to thank them as well. And finally, thank the governor again for really stepping forward and as he has done in many situations, providing resources that are necessary as we are on the front lines here in the counties, partnering with us and working with us to provide some of those resources that we need. So thank you very much, Governor.
Thank you. Resources is a nice word for money. I understand. Thank you to all of our colleagues, and thank you to the county executives, not just for these comments, but for the partnership. And we have an extraordinary partnership. And Steve is right. We've been in this building many times dealing with emergencies, weather emergencies, and the like. And we've handled them all well. It's just getting through it and getting through it with a minimum amount of pain. And that's what we have to do here once again. Again, questions?
Where did you say this patient is currently?
In a hospitalized in Nassau County.
Can you be any more specific?
Nope.
What town? And about any idea how he contracted the virus?
I'll ask Dr. Zucker.
I say we don't know yet, but it's community spread. There's no travel. Originally, it was related to travel that we were looking at, but this is community spread.
Did you say what he does for a living?
Don't know.
No. You know, we have to balance here what the public needs to know, but there's also significant privacy concerns on an individual's health, so that's the balance we're trying to reach.
The students from study abroad programs, I've heard that they may be coming to Long Island. Can you elaborate on that at all?
We are bringing back the SUNY and CUNY students who are at study abroad programs in the first two tiers of the countries that have an issue with coronavirus. They will come back. They will be quarantined for 2 weeks, 14 days. We're working now on where they're going to be. Preferably, they're going to be in SUNY dorms, depending on the situation, but we're working through the logistics right now.
Can you say, Governor, how many people connected to the Long Island man have been quarantined, and or are they?
That's what they're working through now. The investigation, as it's called, really is an interview, asking the person where they've been, who they've been in contact with, and then tracing it back, and that's going on now.
The fact that his illness is community-based, is that a greater concern?
No, you're going to see more and more of that. You know, this is mathematics and reality, right? Mathematics in that one case leads to another case, and the more you test, the more you will find. We're increasing testing capacity. We're testing people who we believe may have been subjected to the virus. So you're going to have a high probability and an expanding universe. So the number of positives will go up by definition. Community spread will go up by definition because not everyone was in China. And someone comes back, they were infected, they infected someone else, that person infected someone else. So you will, by definition, see an increase in the community spread, an increase in the number of positives. We said from day one, when we started this, well, it's the first case, the second case, the third. I said, this is all pointless. There's going to be dozens and dozens and dozens before this is done. Just by math, by probability, you will have a significant number of people infected. We have to stop focusing on how many people are going to be infected. Many, many people will be infected. The question is then, so what does that mean? Well, what does it mean that many people get infected with the flu? Today, we have 15,000 people in hospital beds in this state with the flu. 15,000 with the flu. The flu can be deadly. Senior citizens, people who have a compromised immune system, people who have an underlying illness. People will die from the flu. That same group is the same group that we are watching for the coronavirus. Now, even look at the data that we know in this state. We have about 22 cases. Only a few of them are hospitalized. Well, how can that be? Because the other ones, the 80% that self-resolve, some feel minor symptoms, they're at home without medical care, at home with symptoms, and they're in isolation, but they're at home. Some are feeling better, some are feeling worse, but they're not hospitalized. The ones who are hospitalized tend to be underlying illness, senior citizens, The gentleman in Westchester had an underlying respiratory illness. So the facts of what we're seeing in New York fit the general fact pattern also, right?
What was the underlying illness for the Long Island patient?
I don't think we can say.
And could you say how long does it take to get results back from the time you test for the virus?
About a day and a half.
Last one, you said his condition is improving. What is his status currently?
He's improving. He was not in the intensive care unit, and he's improving. Many people, as the governor mentioned, will have symptoms. They'll resolve on their own. They'll be home. Sometimes you require a little extra support, a little respiratory support, a little oxygen, and then you get better. Your lungs heal, and you get better.
If the man has children or a wife or significant other?
We're investigating all of that, and that's part of the epidemiological investigation that we're doing.
Whether he lives alone?
All of that's part of what we're doing.
Washington State closed some school districts. Is that a decision that would be made school-wide or county level or superintendent level?
Schools make that decision on a local basis. Some schools in the state have closed. Some schools in the state always close during flu season because they want to disinfect the school during flu season. So again, we're looking at everything now as if this is a first case scenario. Many of these things we go through during the normal flu season. Also remember, we went through the H1N1. We went through SARS. We went through a measles outbreak. We went through Ebola. Ebola is a much, much more dangerous condition than what we're talking about here with coronavirus. I mean, Ebola, the mortality rate was very high. So that was a truly frightening and difficult situation. That is nothing like what we're talking about here.
Can you help explain, when you're interviewing people who have come in contact with, say, this man from Long Island, who should self-isolate? Is it the person who's sitting next to him at work? Is there a way to sort of draw that line?
So there's two parts. One is the issue of individuals who obviously have symptoms and there's concerns, and others are close contacts. And so one always asks, what is a close contact? Well, if you're living in the house with someone, that's a close contact. If every day you commute to work with the same person for an hour out on a highway, like the LIE, right, that'd be a close contact. And so that's how we work this through, and this is where the experts and the teams that go out there to do this investigation identify all of that.
Where you see close contact in a non-medical sense, if you're riding in a car with someone for a period of time, right, because it's respiratory. So if you're riding in a car, if you're living in a home and you're in the same room with a person for a period of time, it's that type of exposure that tends to communicate the disease.
In terms of community spread, does that mean you're not sure who he was in contact with who could have transmitted the virus?
That's correct, versus the travel.
But you can't trace it back to the initial travel person. Anything else? Thank you very much, guys. Thank you.
And Governor Andrew Cuomo just holding a second press briefing today on the coronavirus outbreak. This time he was on Long Island, where one person is hospitalized in Nassau County. The man is in his early 40s, tested positive at Wadsworth and is in isolation. He is improving and not in intensive care. Now, the cause, they believe, is from community spread, not travel. Close contacts that were made with this man have been advised to isolate themselves. The governor says New York State is activating the Emergency Operations Center in Albany to closely monitor and respond to the outbreak. There's also 2 emergency operations outposts that have been set up in Westchester, one in New Rochelle and another in Hawthorne. The governor also announced the state is increasing its testing capacity so that testing for coronavirus can be done locally. He says New Yorkers should not live in fear, take precautions, avoid hugging and shaking shaking hands, hand wash frequently, and cough into a tissue. He reminded New Yorkers that 80% of the people who get the coronavirus will self-resolve. Again, Governor Cuomo holding a press conference in Long Island, where one man in his 40s is in the hospital but is improving. We'll have more on the coronavirus outbreak online, cbsnewyork.com, and we will continue to update here at CBSN New York. Stay with us.